Hi everyone, welcome back to the channel. In today's video, we are diving into something that affects millions of people around the world. Oral candidiasis, also known as thrush. So let's break down what oral candidiasis is and what causes it and how you can treat it. In this picture, you can appreciate white, thick spots, which is itchy also, and this is caused by most commonly Candida albicans, which is a tiny yeast. It lives inside us only, and usually it is minding its own business. But when our immune system weakens or the antibiotic wipe out the good bacteria, Candida can overgrow. Candida can be described as a garden weed, which is normally controlled. Just like the weeds can coexist in the garden without overtaking it, Candida exists in the body naturally without causing harm. They both are opportunistic in nature. When conditions are right, when such as when the garden is neglected, like when the immune system weakens or after the antibiotic use, the weeds can grow out of control and take over. Similar to tough weeds that are hard to kill and sometimes require stronger herbicides, Candida can also form biofilms and develop resistance, making it difficult to eliminate with standard treatments. Weeds spread quickly across a garden. Just Candida can move to the various parts of the body, such as mouth, skin, gut, causing issues wherever it spreads. I'm providing you with the mnemonic to remember the characteristic of a Candida in easy way. The mnemonic is Candida thrives, where C stands for chameleonic. It means that Candida albicans can shapeshift between yeast and the hypal forms according to its environment. And the yeast form is unicellular, while the hypal form is filamentous or pseudohypal forms are there. Also, if we talk about the shape, the yeast form is round and oval, while the hypal and the pseudohypal forms appear as elongated cell or branching filaments, which is very important for the pathogenicity of Candida. A stands for aggressive. As we have already talked, it can invade the deeper tissues and causes a systemic infection when the defenses are down. Nocturnal. It often flares up in hidden and moist areas of the body, and especially during the period of low immunity. D stands for the dual nature. It lives harmlessly in the body but can switch to the pathogenic in immunocompromised patients. Stands for the immunocompromised target. D stands for the diaper rashes or the thrush, or A stands for the antibiotic survivor. In thrive, T stands for tough fighter, as it is resistant to treatment, particularly when it exists in the biofilm form, making the infection hard to clear. H stands for heat resistance. R stands for the resistant biofilms, which creates strong biofilms that protect it from the antifungal treatment. I stands for infects multiple areas like mouth, gut, skin, or even the blood. V stands for the virulent, that it is capable of causing the life-threatening infections in vulnerable patients. E stands for endemic. It is naturally found in the human body, living peacefully until the balance is disrupted. S stands for the skin and the mucosa lover. They prefer warm, moist environment like skin folds, mucous membranes, and the digestive tract. Candida species can cause wide range of infections which may be superficial or invasive. In mouth, the superficial infection is known as the oral thrush or oral candidiasis. The most common triggers of candidiasis is weak immune system, antibiotic or medications when taken in the long term, diabetes, denture wearers, and smoking. Yes, smoking can also contribute to oral thrush. Saliva naturally inhibits fungal growth. So, in the conditions which reduces salivary production, like in Sjogren's syndrome or any other medication that can predispose a person to thrush. Apart from this, infants and elderly people who have underdeveloped immune system while the elderly people having weakened immune systems, making both the groups more vulnerable to oral thrush. Symptoms of candidiasis. Here I am providing you a mnemonic for easily remembering it. It's a white pain. Now, some of the telltale signs of candidiasis are white, creamy patches on the tongue, gums, or the inner cheek, red inflamed area beneath these patches, pain or soreness in the mouth or the throat, crack at the corners of the mouth, which is known as angular cheilitis, and the patient finds swallowing very difficult if the infection spreads to the esophagus. And one point I would like to add here, that the white cotton cheesy material which is on the oral cavity can be removed easily and can be wiped off easily with the help of the cotton, and below we can see the erythematous areas. There have been a number of classifications, but the most useful classification of oral candidiasis is the one which deals and combines chronicity with a clinical presentation. You may remember this classification through the mnemonic PEACH HD, where the P stands for the pseudomembranous candidiasis, which may be acute and chronic form. Erythematous candidiasis, which is again in the acute and the chronic form. Angular cheilitis is a chronic form of oral candidiasis. Chronic hypoplastic candidiasis, hypoplastic candidiasis, and denture stomatitis. Acute form of the pseudomembranous candidiasis is recognized as a classical candidal infection. The infection predominantly affects patient taking antibiotics, immunosuppressants, or having a disease that suppresses the immune system. The infection typically presents with a loosely attached membrane comprising of fungal organisms and cellular debris from the desquamated epithelial cells or lymphocytes, which leaves an inflamed, sometimes bleeding area if the pseudomembrane is removed. Chronic form of pseudomembranous candidiasis lingers, or it keeps coming back due to ongoing underlying health issues of the patient. Please go through this table where I have described the differences or the chief differences between the acute pseudomembranous candidiasis or the chronic form of the pseudomembranous candidiasis. Second classification of candidiasis on the basis of clinical features is erythematous candidiasis, which is also known as the atrophic candidiasis. It appears as red and inflamed area with no white plaques as it is in the pseudomembranous form. It is most commonly found in the palate, tongue, or under the dentures, and it is more common in denture wearers, HIV or AIDS patients, and the individuals who are using inhaled corticosteroids. Please go through this table where I have described the differences between the acute and the chronic atrophic erythematous candidiasis. Denture stomatitis is a form of chronic atrophic erythematous candidiasis, and which is a long term, and usually it is a predisposing factor, that is the continuous denture wear is present in these patients. There is redness or inflammation under the denture, especially on the palate. The most common causes are the poor dental hygiene of the patient and wearing the dentures overnight. The population which is most commonly affected, I have already described, the denture wearers, particularly those who do not clean their dentures regularly, or they don't take out their dentures at night also. They are at the more risk of the denture stomatitis, which is nothing but a form of chronic atrophic erythematous candidiasis. I will post a separate video on different aspects of the denture stomatitis, its classification, and the management part. Classification of candidiasis is chronic hypoplastic candidiasis. It is also known as the candidal leukoplakia. It appears as a white plaque that cannot be easily wiped off. It resembles leukoplakia and also has a potential for malignant transformation. Location, it typically occurs in the cheeks or the tongue, and the most common smokers and those with the compromised immune systems are at higher risk of candidial leukoplakia. Now we'll read about the two Candida associated lesions. The first is angular cheilitis, then the second is median rhomboid glossitis. Angular cheilitis present itself as an infected fissures. It present as a cracking, redness, and soreness at the corners of the mouth, and it is often surrounded by erythema. The duration is long term or it is recurrent. Common causes of angular cheilitis is excessive moisture, poor fitting of the dentures, or nutritional deficiencies where there is a deficiency of vitamin B12 deficiency, vitamin B2 deficiency, or the iron deficiency, or even the loss of the vertical dimensions are all associated with angular cheilitis. And elderly people, those people who wear dentures, or the individual with the nutritional deficiency, as I have already stated, they are at the higher risk of angular cheilitis. Rhomboid glossitis, it apparently arises from the junction of the posterior third and the anterior two-third of the tongue, and it is clinically characterized by an erythematous lesion in the center of the posterior part of the dorsum of the tongue. It appears to be oval in configuration, and this area of erythema is due to also the atrophy of filiform papilla, and the surface may be lobulated also. The etiology of median rhomboid glossitis is not fully clarified by biopsies yielding Candida hypal in more than 85% of the lesions. Median rhomboid glossitis is asymptomatic, and management is restricted to a reduction of predisposing factor and the systemic antifungals. Diagnosis of Candida albicans is mainly on the basis of clinical examination, but a scraping of the white patches can be examined under the microscope also to confirm the presence. Or in rare cases only, the diagnosis is uncertain, then we may go for the culture and the biopsy of that particular lesion. So now we'll come to the management part of oral candidiasis. The treatment is actually pretty straightforward. It typically involves antifungal medications. For mild case, you may prescribe to your patient a topical antifungal like nystatin, or in more severe cases may require an oral antifungal like fluconazole. So, antifungal treatment is the mainstay, but it is very important to manage any underlying conditions contributing to candidiasis, and neglecting this factor, it may cause a reoccurrence of the infection again and again. For instance, if controlling blood sugars in diabetics, improving oral hygiene for the dental wearers, or treating the dry mouth can prevent reoccurrence of candidiasis. Use of corticosteroid inhalers in asthmatic patients can also lead to candidiasis. So for those using the corticosteroid inhalers, they should rinse their mouth after each use to prevent thrush. The denture should be thoroughly cleaned, and it should be left out overnight to reduce the risk of the infection. Certain lifestyle adjustments can lead to a decrease in the reoccurrence of the infection. Smoking cessation and reducing the sugar intake can also lower the risk. The complications of oral candidiasis, it can lead to esophageal candidiasis when it spreads to esophagus, and the patient may find very difficult to swallow, and it requires more aggressive treatment as well. Apart from esophageal candidiasis, systemic involvement may also occur due to the candida, especially in the immunocompromised patients, where it can spread beyond the mouth to the other parts of the body, potentially leading to life-threatening systemic infection. Candidal infection is preventable. The patient should be advised to have the good oral hygiene with the proper care of the denture. Healthy diet should be followed with a healthy lifestyle, and the blood sugar level should be managed if the patient is diabetic, and if using corticosteroids or the antibiotics, the patient should follow the medical advice and the practices that minimizes the disruption of oral flora. So this was all about oral candidiasis. it isn't common, but it is also highly treatable with right care. If you found this video helpful, make sure to give it a thumbs up and share it with anyone who might benefit from this information. And of course, don't forget to subscribe to our channel for more videos. See you in the next video. Till then, bye bye, take care.